everyone, and welcome to Canadian Science Policy Conference 2020. And today we have the pleasure of speaking with Dr. Camelia Tigau. Dr. Tigau is a senior researcher and coordinator of Area of Integration Studies, CSAN, Center for Research on North America at National Autonomous University of Mexico. Welcome, Dr. Tigau.
Thank you.
Um, so, Dr. Tegu, we know that you have worked a lot on skill migration and scientific diplomacy. So, can you tell us a little more about your work and what your position entails?
Okay, so I currently coordinate the area of integration studies at the Center for Research on North America at UNAM. We have a university, one of the biggest in the world, with 3,000 students. And my center is dedicated to the study of the relations between Canada, Mexico, and the United States, that is North American studies. We consider ourselves a very important regional hub for this type of research. We have lately established a network for North American researchers. So this is a broad context where I work. And I have spent the last 12 years studying skilled migration, that is the migration of professionals across the region from a comparative perspective. And my last book is on discrimination and privileges in this type of migration.
Thank you, Camelia. Congratulations for your work. So to begin, so 2020 has been an unprecedented year for everyone, be it researchers, be it science diplomats or policy researchers. Since the beginning of the March, when it all started, we have seen there is a lot of shortage of PPE, testing kits, and mostly healthcare professionals. So, what is your take on like migration of African medical professionals and healthcare workers to Western countries to fill in the shortage created by COVID? And how do you think COVID has changed the global migration and can change it further in future?
Okay, I would say during this COVID pandemics, the understaffing of hospitals in the Western countries and all over the world has become more apparent in both countries of origin and destination. And of course, beside this long-term shortage, we have medical personnel available that was more exposed to COVID. So there were significant casualties in health workers all over the world. You were talking about North African countries. Of course, the US and Mexico are leading the list of health workers who died from COVID, but also we have countries such as Morocco, Algeria, Egypt, who are on the blacklist also, according to Amnesty International. So this could, of course, increase the need of foreign-born doctors, but countries, I would say, they are not ready to take action because these doctors need certification to practice abroad. So public policies to speed up certification under COVID have been very difficult to implement. We have the Canadian case where a few doctors, around 25, were certified in Ontario and very, very few in British Columbia to support with the pandemics. So there is a program, but it doesn't work properly because of the requirements for these doctors to practice. Now, if we recall the most recent previous crisis, which was the financial crisis in 2008 and 9, there was talk of a reverse brain drain during that crisis, which did not really happen because knowledge workers tend to change workplaces rather than turn home. When we talk of North African countries, they have high rates of health immigration to Europe and, of course, the US and Canada, Australia. But we do not have a correct prevision of what the pandemics will entail. We don't know the outcome of the crisis, as very few governments are and associations are really collecting quantitative data. So this means that in general, we will have to rely more on qualitative rather than on numbers when studying COVID. But returning to health migration, medical brain drain, these doctors are underemployed and underpaid in their own countries of origin. So the pandemic will just emphasize a crisis that was going on for years. So I would perhaps extend the discussion of North African countries to African countries in general, since we have countries such as Egypt, Nigeria, South Africa, that are among the top providers for healthcare abroad under the COVID pandemics. And of course, this may affect the healthcare in their own countries of origin. For instance, we know that with the years, more than 60% of the doctors in Zimbabwe tend to emigrate. If those doctors stayed in their own country, but did not properly attend patients, there would be a problem as well. There would be brain drain as well, internal brain drain. So in this type of migration, the risks depend on the size of the country and the disponibility of healthcare. Okay, so just to round up my answer, healthcare and medical migration is the most extreme case in the study of skill migration and this brain drain approach. And we have got maybe half a century of literature on the harm that this type of migration of doctors and nurses from countries with high mortality rates are doing to their countries of origin. And the North African countries are such extreme case studies where hospitals become understaffed because of international migration. But this is one part of the picture, which is broader than healthcare immigration from North African countries. We have countries that are that have more doctors and nurses than they should have. We have the Cuban case. We have nurses from the Philippines who are trained to work abroad. So we have a very, I would say, varied panorama.
Yeah, thank you, Camelia. Yeah, we can see like African countries sending their healthcare professionals when they themselves have shortage of medical professionals there. I think it's a big topic to debate. Okay, so moving on to our next question. So you have done a lot of work on diaspora communication, and what are your thoughts on how diaspora communication might be the key in a crisis like COVID-19, where governments, international NGOs, and other organizations are either too bureaucratic and inefficient, or they lack access and local acceptance?
Okay, I am a journalist myself. I have practiced the communication and I really appreciate the virtues of communication. I would say communication is key to how we resolve not only this particular crisis caused by the pandemics, but also a more permanent perception of the refugee and migrant crisis in the world. So I would think there's been a very significant change in the history of migration diplomacy and in diplomacy in general in the 21st century. And this transformation has led to the democratization of diplomacy, where common people, migrants themselves, but also politicians, have taken over the traditional tasks of the diplomats. And this has a very good outcome. Migration and migrants have become more visible, but they are also perceived and depicted in many countries of destination in dangerous ways, in social networks and media. And just to paraphrase some colleagues from the Hague Journal of Diplomacy, I would say there is this shaken state of mind around migration in which, well, migrants are perceived as a multiple threat to culture, economy, politics. So, of course, in such a context, there are multiple channels of diaspora communication, all marked by the broader digital and educational divide of the diaspora communities. So we have skilled diasporas that may have more access to communication strategies. They clearly state their role in a certain country. And we have other types of maybe temporary agriculture workers that depend on what the others have to say about their presence in the country. So just to round up, okay, the COVID pandemics was a very good opportunity to point to the role of these essential workers, especially in healthcare, in agriculture. But it has also emphasized this broader crisis on on how we communicate on migration. Okay, so this is what I have to say.
Yeah, thank you so much for such a good information about the topic. With an entirely virtual conference this year, this will be a new experience for many and an opportunity to reach a wider audience than ever. And you are a panelist at CSPC conference. What are you most looking forward to the conference?
Well, I am new to the conference, I have to say. I haven't participated before, but I have some experience in organizing virtual conferences with colleagues from Latin America and the US and India. And I believe that one of the great outcomes of the pandemics has been this thriving in the internalization of science. We cannot physically move, but we are close to each other. We are forced to apply communication platforms that we knew before, but we were underutilizing them. So regarding the conference at the Canadian Science Policy Center, specifically, I'm looking forward to update myself, of course, learn more, and I will share my knowledge on Indian workers who move from the United States to Canada in a sort of a different type of brain attraction. And of course, be part of a team for almost a week. Why not establish a long-term communication basis and collaboration with the Canadian Science Policy Center.
Thank you, Camelia. Lastly, is there anything that you are currently working on and you want to share, or any closing notes? And where can our viewers go online to learn more about your work?
Well, since you asked me about the health migration, which is the big topic nowadays, I would maybe recommend a paper I wrote in the journal Migration and Diasporas, an interdisciplinary journal that is called in India. And my paper is called The Scientific Diplomacy of Medical Diasporas, a case study of foreign medical doctors in Texas. And for this paper, I interviewed medical doctors from 9 countries. And I sort of point out to different use of brain circulation theories in the study of medical migration. We tend to consider medical migration as always a problem and emblematic case for brain theory. But my findings also demonstrate, some good outcomes in terms of knowledge sharing and, of course, from the perspective of individual growth and on a professional level. Science may actually benefit from the health migration. And okay, for those who read Spanish, we have published two series of books on Canadian studies at CSAN in 2018, 2019, and we are preparing two more for the next year. So we are involving Canadian and Mexican experts. We believe it's a very fruitful cooperation. So this is just to point out that we are doing some research on Canadian studies in Mexico, which you are welcome to revise. Okay.
Yeah. Thank you, Camelia, for sharing your views and giving us so much information about the brain gain, brain drain, and probably brain circulations. And
Yes.
congratulations again for your work. Thank you so much for coming. And thank you, everyone.
Well, thanks for having me, and I look forward to see you soon in November. Right? Thank you.
Yeah, looking forward to it. Yes, thank you.